The thing I care about most at work is probably patient care, quality of care, making our patients feel at ease and making it the least traumatic experience that it can be.
The prospect of seeking medical treatment for yourself or your loved ones can be one of life's most daunting experiences, but it needn't be. As Britain's leading provider of independent healthcare, we're dedicated to your well-being every step of the way. So tell us what's on your mind, and we'll give you some straight answers.
I've got a very, very demanding job and a very, very busy lifestyle. I just can't afford to be kept waiting around for hours.
Quite understandable, which is why at BMI, a preliminary consultation is planned around you, strictly to the times we agree.
When I first got in touch with BMI, they offered me an appointment straight away that suited me.
It's almost like a family here because patients do come back and, you get time to spend with them and get to know them and, they know about you and it's nice.
I brought my father to BMI Healthcare because we wanted to see a specialist and we wanted to be seen quickly.
At BMI Ross Hall Hospital, you can rest assured that from consultation to aftercare, everything is led by a consultant. That applies whether you're an outpatient or need to be admitted. Your consultant takes ultimate responsibility for your well-being while you're in our care.
This is the only way to look after somebody, that a consultant controls their care and that person has an interest in what they're doing. The nice thing about working at Ross Hall is that you see the patients back quickly, and often when they're well, they're very happy. Consultant-based care has been shown extensively to be more effective, and if a consultant does your procedure and the person who's looking after you knows you, then there is a higher quality of care.
Finding out I needed an operation wasn't exactly a good thing, but I shouldn't have worried because I was in safe hands.
The pre-assessment allows your consultant to determine an appropriate treatment programme. That might require a range of tests to confirm the prognosis or to evaluate your health to ensure you'll respond well to surgery. What's important is that you'll always be informed of what to expect and the likely cost. And if you have insurance, then we'll help you to understand your entitlements and how to approach your insurer so that you can proceed in total peace of mind.
At BMI, you get your own room, which means friends and family are able to visit whenever they like, really. It makes visiting much more flexible. You're not sort of restricted by visiting hours, which is a great sort of comfort and reassurance to myself, knowing that my friends and family can pop in any time.
At any BMI hospital, patients enjoy private ensuite rooms with all the usual home-from-home comforts. Friends and family are welcome almost any time, and appetites can expect some very individual pampering. All your meals are fresh every day, and our chefs take great pride in designing menus either to your preference or the clinical requirements specified by your treatment.
Patient might feel a bit anxious about coming into hospital to have a surgical procedure, but we have very low infection rates. We make sure that all the staff adhere to infection prevention and control standards. We work with all the housekeeping staff, and I think that just shows the patient as well that we take it very seriously.
Every patient's treated individually and looked after as if it was one of your own family. We do get cards and letters sent in to thank the theatre department and also named nurses. It makes everybody feel that they've done a good job.
As the largest private hospital in Glasgow, Ross Hall is renowned for its acute care services, including oncology, orthopaedics and breast care. Ross Hall is the only private hospital in Scotland to provide intensive care support for patients.
We're very lucky here from the point of view that I can spend time with patients. We can chat to the patient prior to them going for surgery and work with the anaesthetist to make sure that they feel confident and comfortable in the immediate post-op phase and until discharge home.
The staff and consultant have been really brilliant. They've really looked after us and it's been a great weight off my mind.
And that, in a nutshell, is what at BMI we call the patient journey. It doesn't end there, of course. Once you're ready to leave hospital, we will be on hand to arrange ongoing checkups and any medication from our pharmacy that your consultant deems necessary for a comfortable recovery. So, are there any more questions?
Not if we're doing our job right.